So I am sitting here with Dr. Ross McCulloch, and I have 1,001 questions about healing, physically and emotionally, and he seems to be a wealth of information. So we're just going to ask a few questions and see where it goes. So I first came to you, I believe, 4 years ago.
Yes.
I was on vacation, on holiday. I was over here in England, but I live in the States. And I've been seeing chiropractors for years, for headaches.
Yeah.
And it's always been a bit of a quick fix.
Yes.
I get a couple of days out of it, and then I'm sort of back to square one.
Yeah.
So I just actually opened the Yellow Pages and found you by chance.
Yes.
And, was just looking to get some relief for a few days.
Yes.
And I remember what happened. I laid on your treatment table, and within about 30 seconds, you said, "You've got a birth injury."
You've got a birth injury, that's right, yes.
And I was amazed, but I was rather relieved too, because it gave me an answer.
Yes, definitely, yes.
Which I'd always been looking for.
Yes, that is important, definitely.
But it blew me away. So
Yes.
I would like to kind of know a bit more about how you feel it. Why don't regular chiropractors feel that?
Yes,
And
yeah.
you just called it out, and I gave you no information.
Yes.
So
I'm a
talk
great
about that.
believer in one of the main factors of disease, unease within all of us is injuries caused by the birth process. The birth process is a labour. It's even at its very best, it still puts the spine out, especially the first three cervicals. It still misaligns the jaw and the cranial. It was really the osteopathic profession that brought in cranial work, realigning, moulding the cranium. And it was them that highlighted birth injuries, the trauma caused to the human structure, the trauma caused to the human neurophysiological neural net. Now, the chiropractors have dabbled in it, but it was really applied kinesiology that took it 100 years forward. And I feel it's highly significant that every single patient that I treat, we deal with birth injuries, no matter if they come in with a colitis, an asthma, emotional troubles, whiplash injury to the neck, you're going to get down to the birth trauma.
Mm-hmm.
It's even more obvious when they've had the ventouse birth, which is the suction, or they've had the forceps, which is the clamps to pull out. That's even more, that is direct physical trauma to a cranium in a child that's not even fully out yet. And it's the system that gets traumatized is what's called the stomatogasthic system. It's from here upwards. Involves all the neck muscles, front and back, especially the first three cervicals, TMJ, and all the cranial muscles, and all the cranial joints and cranial bones. And I think that the kind of loose foundation stones of any chronic illness, and any chronic illness in the body, any chronic illness to do with the emotions, and any chronic illness to do with hormones, immune system activity, etc.
Mm-hmm.
Now, how I knew about you is because I can see it. You observe it in the face. You see it in the face. With my 30 plus years of experience as an observer, you can just see it. You begin to look at the posture of the neck, how the mouth articulates, how you breathe, what your facial expressions like, how you swallow, how you talk. All these are pieces of the jigsaw, and you can say, there we are. Here's someone suffering from a considerable birth trauma.
So you actually probably saw it before I even got on your treatment table.
Oh yes, so the time I'm sitting just chatting to you, you're saying yes.
That's really interesting.
That's it for me.
And so, of course, with Western medicine the way it is, and with most medical doctors being trained the way they are,
Yes.
and the health system, the NHS, and in the States, insurance companies, which is a whole nother topic.
Yeah.
It's set up that we have symptom control and drugs, and so how? A, what do you have to say about it, and B, how does one even go about explaining to somebody that's not ever going to lead to healing?
That's right. It's getting to the cause of the cause of the cause. It's getting to treating the person. We treat people. I treat people. I don't treat diseases, or I don't treat symptoms. I look at the person, And as we're talking about birth injuries, I think one of the causes of disease, unease within the body, which can lead to a pile of a myriad variety of symptoms, is birth trauma. Even a mother who says, well, it seemed to be a normal birth, it took 4 hours, the cranium and upper neck will still be traumatized. It's my contention, and it's the osteopath started this, that when you're born you injure your right shoulder and your left knee. So if somebody comes into me with significant right shoulder problems or left knee problems, you're going to take that upstream to the original cause of the birth trauma.
Mm-hmm.
And over my experience, you will always find birth trauma when that happens. In that one example, you will always find birth trauma in asthma. Always in asthma. Because another thing is the other immune system problem that you will find birth trauma is irritable gut syndrome. Because these are supplied by a neural net that comes out the first 5 cervicals. What's called your phrenic nerve and your vagal nerve all supply these tissues, gastrointestinal tissues, lung tissue, diaphragm. And these are all being damaged physiologically, not pathologically, because you can't take a picture of it and show something. It's a physiological damaging that manifests as a diaphragm that's not working, or an immune system, or peristalsis that doesn't work as efficiently, or it's overworking, everything's too much. And this area here, I've said the first 3, but it's always the first 3 and inclusive of the first 5 that get traumatized at birth, they get misaligned, they get put out of alignment.
To presumably varying degrees of seriousness. When somebody's, like for example me, I mean at age 43 I do have had days when I'm bedridden with the pain and discomfort that would tend to make someone then search out somebody like you.
Whereas you've used your pain well, you've said, I'm not tolerating this anymore, I don't want palliative treatment, I don't want to be fixed, I want to get down to the causes of the cause of the cause. And we're doing that, we've done that, and you can see the results in that. And that's essentially for everybody.
Right.
You know, everybody has that.
Right.
It's highly significant, this. As far as I'm concerned, it's implicated in almost all the diseases that you can find in the diagnostic textbooks, manual. It's all that it's implicated. It might be implicated 10% or 20%, but that's hugely significant if it's you. But when you get to the immune disorders, it goes, and in the hormone dysfunctions, it gets right up to 50, 60, 70% of their problems. Remember, we don't treat people, we don't treat conditions, we treat people who look at the whole person. Just by realigning the cranium will not completely cure an asthma.
Okay.
Or will not completely cure irritable bowel or an ulcer or anything like that.
Right, and of course most people go down the path of drugs, which then make you more toxic, and that sits in your liver, and you've got more problems.
It's taking a symptom away. It kills a pain, or it alleviates a discomfort. It doesn't get to the cause of the cause of the cause.
Right.
Which any health practitioner on our side of the fence, the holistic health practitioner, looks to find the cause of the cause.
Gotcha. Okay, good. So let's do a couple more videos. We're gonna, I think maybe end this one, and then we're gonna talk about. You mentioned, you didn't mention ME specifically, but I think we're gonna talk about that.
About ME, and we'll talk about hyperactivity in children.
Yes, which is a biggie.
Which is a biggie with the cranial trauma too.
Yes. All right, very good. So we're Dr. Ross McCulloch, who is a chiropractor and applied kinesiologist, and so much more. All right.